All right, so a lot of them also I put the colored versions, you know, where each bone, each individual bone is colored differently just for your orientation purposes. For the most part, I use just the plain ones without the coloring on it right there, right? But these kind of help you learn the different individual bones right there, right? Same thing here, right? Looking in individually, like on this picture, you could make out the vomer over here. You can make out the inferior nasal concha because they're colored. Otherwise, when you get to the non-colored ones, it's a little harder, right? Your lacrimal bones, your nasal bones. And so in this picture, right, those are a little harder to identify, right? But so for this picture, this frontal picture like that, we're looking at a couple of your foramen. If you see the word foramen, you should be looking for like a hole or a canal of some sort, some kind of space. If you see if you see the word fissure, it means like a big kind of space, right? A bigger opening right there. And they, again, these are where like you'll have blood vessels and nerves going through these little things, right? So maybe when you're a nurse or something, you might have to do an infraorbital block or something like there, these nerves coming out here that you'll have to anesthetize, right? So this top one, the orbit, right, is your eyeball. So you got a supraorbital foramen and an infraorbital foramen, right? Above and below the eye right there. And then in the back of the eyeball, you got this supraorbital fissure right here. And again, on my lecture videos, you can see all the nerves and stuff going through this hole right here, right? So those are around the eye right there, and they have something to do with orbital because of the eyeball. And then over here, for some unknown reason, it's called a mental foramen. This is the mental region, those little holes, those pair holes on either side. Right? That's the picture. And then I have a couple pictures inside the skull. These aren't usually visible on most of the skeletons, but you have these sinuses right over here. You got your frontal sinuses. These are like inside. You have to look at a cross section where that's been exposed. You got the maxillary sinuses, the nasal sinuses, the ethmoid sinuses over here, right? So like in this picture, you can see the maxillary sinuses on the side. You can see the ethmoid sinuses over here. You can't see the other ones. These are the orbits for your eyeball right there. And then this is just a couple different views, right? Just for your understanding. Right? You got those maxillary sinuses, big ones on the side of the nasal cavity. A little bit of your ethmoid sinuses over here, and then those frontal sinuses. And then this is an X-ray, right? When you take an X-ray, those spaces kind of come out. Again, the maxillary. This is probably the sphenoid, actually, the ethmoid, and the frontal. So this is from a side view. This is the sphenoid sinuses back here. This is the frontal sinus. And then the other things we can see here are this is the perpendicular plate of the ethmoid bone that you're looking at here from a side view. This is the crystal galley of the ethmoid bone. So that's kind of an unusual view there, but that's what those structures are. And this is another sinus picture, right, where you can see this big space, this maxillary sinus is on the side. So when you have a sinus headache, it could be anywhere. Usually it's up in those frontal sinuses. That's an inflammation of that. All right, so that's the front of the face, and then I included those sinuses. Then we're going to look at the side, right, the lateral view. And, you know, you should be able to recognize all the bones from the lateral view. And again, if you want to remember them in a stupid way, you do that old people from Texas. And then this eat is the ethmoid bone. You can't really see it here. And then the sphenoid is over here, spiders, right? So occipital, parietal, frontal, temporal, and then your ethmoid and sphenoid. Those are your cranial bones. and then the other facial bones we'll get into in a second. And so over here, I'm pointing out a couple of the features you could see. You could see the supraorbital foramen right here. You can see the mental foramen. And then on the jaw here, you got the mandibular ramus. You have the condylar process. You have the coronoid process right here. And so those two named ones, this one goes into your mandibular fossa of your temporal bone to make your jawbone, right? Or your joint, your temporal mandibular joint, your TMJ. And then those are those features of the jaw. So here again, here's your temporal bone. And it goes all the way around here. And that's all of the temporal. It's a very complex shape. So you have the squamous suture, and you might be able to relate that to the fact that this flat part, as we'll see later, of your temporal bone is called the squamous region. Right over there. So that's the squamous suture. This going down like a crown, right? That little tiara, a coronal suture, dividing your frontal, or connecting rather, your frontal and your parietal bone for the most part. Right? That would be that guy right there. And then the only other one would be the lambdoid suture, right? And that'll be connecting your two parietal bones with your occipital bone in the back. Those are the sutures. Again, this is your zygomatic bone. Over here, there's the temporal bone. Your zygomatic bone has a temporal process, right at the end right here. And your temporal bone had that zygomatic process. And they join up together to form the zygomatic arch. And the last thing was your external acoustic meatus. This is where your ear would be, right? So that's basically your hole in your ear, right? Right, so that's your side view. There's not really a whole much more to ask on this one that I would see. All right, now we're looking at this is exactly the one on your test. Here's a couple more things labeled. Again, what bone is this right here? This is part of your maxilla. Okay, and it joins up with your palatine bone, right? This horizontal region of the palatine bone to form your hard palate of your mouth back here. And so this portion, if I ask you what feature this is right here, this is the palatine process, right? Because the maxilla has a whole bunch of stuff to it, but it's part of it'll join up with the palatine bone. So that's the same pattern as this right here, right? Your zygomatic bone has a temporal process joining with the temporal bone. It joins up with the zygomatic process of the temporal bone. What else? And then this is the actual vomer. And then the purple bone, not labeled here, but that's the sphenoid bone right here. And then we get this next red region. That's your temporal bone. It's got a whole bunch of complex stuff on it. What's labeled here is that zygomatic process. These little tooth-like things right here are called your styloid processes. And we have a couple more styloid processes right on the ends of your distal ends of your radial and your ulnar bone as well. But that's a styloid process up here. And then you also have a mastoid process over here. This will be a major connection for your sternocleidomastoid muscle when we get to that. And for this picture, we have this right here is an articulating facet. This is where it meets up with the atlas, superior articulating facet of your atlas, your C1, and this is called the occipital condyles. Condyles is a joint surface. If you ever see that word condyles, you can think joint surface. And then the big hole in the middle is where your spinal cord and your brain stem going to your brain right there. That's your foramen magnum, big hole. And this is a close-up. We're looking at some of the holes right over here. And again, you'll want to identify the actual foramens or holes or passageways with the individual bones, right? So this blue part is your part of your sphenoid right over here. And the only one visible in this picture is the foramen ovale, right? It's got an oval shape kind of right there. So in this picture, that's the only one visible in your sphenoid, although you do have a couple more. Over here, right? So here's your sphenoid. Here's your occipital bone. Here's your temporal bone. They all kind of meet up together and there's a little space in between them all. And then sometimes some pictures will only have, it won't have your occipital bone, but these two. But in any case, this hole right here, this passageway is made up by kind of bones connecting with each other like that, right? So that little hole is your foramen lacerum. And again, these are major holes that blood vessels and nerves are going through. All right, so that's made up by formed by the sort of space left over by these different bones. And then for your temporal bone, right here, wholly within your temporal bone, right over here, you have the carotid canal. Right, so this is from the inferior side, and this is the actual carotid canal. Just posterior to that, so you got these two holes here. That's your carotid, and this is your jugular foramen. Here, so this is one of your major veins draining your head, the jugular vein. This is where your carotid artery goes into your brain. So notice on the inferior side, they're right next to each other. But when we look on the superior side, they kind of end up far removed from each other. Just make mental note of that. Right, and then, so the big hole again is your foramen magnum. Those are your external acoustic meatus. Why they're called a meatus, I don't know. This is where your ears are, remember, right? Yeah. So your internal acoustic meatus is going to only be seen from the inside, right? So those are some of the, I think the only ones you could see really from the, well, you can sometimes see the foramen spinosum on some models right here. Here they're not showing it. So now we're looking at an actual one, right? From everything we looked at before. Again, this is the maxilla up here, right? Making up like the first 2/3 of your jaw or so, right? Whereas the palatine bone would be over here. Right, so that would be palatine, maxilla bone for the bone, or if I asked you what features that, you'd say palatine process, right? And then this is the palatine bone. So moving posterior, these two holes right here are your within. This is your sphenoid bone right here. Somewhere up here, right? So that's your sphenoid bone. These are entirely within the sphenoid. Those are your foramen ovale, right? You also have, I don't have these pointing here, but right here is the foramen spinosum right there. And then over here, right, this is all the underside, the inferior version of your temporal bone. And again, that where you have that space created right there, that's your foramen lacerum. So it's not within any particular bone, it's made up by the three bones in this case, right? Because over here is your occipital. Over there. Right. And so that's made up by those three bones, or sometimes it looks like it's just made up, it's just within the sphenoid and the temporal. But the other one like that is your jugular, right? Because that's made up by your temporal. And your occipital bone, right? That crack that's made up, that's your jugular foramen. And then right anterior to that is your carotid. And right, so however you want to learn these, just maybe go from anterior to posterior, something like that, to kind of learn all these features and foramens and stuff. Last thing here would be right. It's not really super distinct, but it's distinct right here, right? On the sides right here are these, right? Just immediate lateral to your foramen magnum are those occipital condyles, right? That's again where you had C1 rest up against. And this is just a close-up version, right? Going backwards from what we just did. Here are your occipital condyles. Not super distinct, but again, that's a facet where those are going to articulate, right? You could kind of make out, but they weren't really clear enough for me to use, but that'd be your jugular. And then these holes, remember, which are entirely within the carotid canals, entirely within your temporal bone right there, right? That's how you know it's not the jugular, if you can make out these. Right, and what else we got? Within the sphenoid, again, this is the part of the sphenoid. You got those foramen ovale, as well as the spinosum, foramen spinosum over here. The little holes right there.
So that is the inferior view of the skull. And the next thing we're going to do here is flip this guy around, and we're going to open up this skull right over here and remove top part of the skull to look inside the brain, to look at all the features of the internal skull from this superior view.
Right over here. Now this is a colored one, so it's a little easier. Right, your sphenoid is well laid out, your temporal bone, your occipital. Right, so going from, do I have anything else? Right, going from the most anterior thing, you have this whole region. This is called your sella turcica, otherwise known as a Turkish saddle in some language, right? And coming out of these holes right here, you have your optic nerves. So these are the optic canals, right? The nerves are coming out, they're crossing over here, right? And it's called a Turkish saddle because it looks like some kind of cowboy saddle. So you could think of a cowboy sitting here holding onto these reins. And then you have three holes right here, R, O, S. So some people have used the mnemonic cowboy Ross, right? Rotundum, ovale, and spinosum over here. And those are entirely within your sphenoid bone. Right? So sella turcica, optic canal, foramen rotundum, the foramen ovale, and foramen spinosum, all within your sphenoid. And then again, in this picture, you see that the hole doesn't line up with your occipital, but that is the foramen lacerum over here, created by these two, just like your jugular is created by your occipital and your temporal bone. All right, so this in red, again, is your temporal bone. The carotid canal is not really showing in this picture for whatever reason. Maybe because it kind of leads into this, into the foramen lacerum sometimes. But this ridge right over here, this kind of ridge over here is called the petrous portion of the temporal bone, right? This kind of pyramid shaped thing. And on the posterior side of that petrous portion is this hole right here. This is your internal acoustic meatus. And so inside this ridge right here, remember your external acoustic meatus, that would be out here. This is where like your inner ear stuff is. So your auditory nerve is going in there and innervating that apparatus. So that's your internal acoustic meatus. And then again, their jugular one. Again, this is just to kind of orient you, to compare stuff. You got the frontal, ethmoidal, sphenoidal, parietal in green, temporal over here. Right? And so like this portion of the temporal bone up here is that squamous portion. It's like a flat surface, squamous, squat, flat. And then this is the petrous portion of the temporal bone. And then in blue here, you have the occipital. And then this close up, the holes right here, spinosum, oval, lacerum for these foramens right here. The lesser wing over here of the sphenoid bone. I think this should be up on the petrous portion over here, and then this is on the squamous portion down over here for your temporal bones. And this is, there's no labels here, but I'll put these in from this picture because I have a close-up, but just kind of orient yourself with the overview and then look at a couple of the features here. In particular, this ethmoid bone here, you have the cribriform plate. That's with all the holes here. Those are the olfactory foramina, right? These are the holes. This is where your optic nerves go in. They dangle their little nerve endings through your nasal cavity here to pick up smell, right? So that the flat portion is called the cribriform plate. And then this little spike thing that sticks up is your crystal galley. So that's your ethmoid bone. And then you have your sphenoid. If you could make out the sutures, and you can kind of tell by those two holes, which you can see clearer on this side, the foramen ovale and the spinosum. But this region right here where it joins up with your frontal bone are the lesser wings. And then this region down here is the greater wings, right? Looking down from the sphenoid bone right here. And this one, here's the sella turcica. You can see where these are all joining up together. So this must be the foramen lacerum right here. And then here's the ovale and spinosum. And then looking backwards right here, foramen lacerum. Over here, the ovale. And then the spinosum. The jugular in this one is down over here.
Okay.
It's kind of hard to see. I wouldn't ask on this one. I like to make sure that you could see clearly the occipital and temporal bone, but it would be down there. And you cannot see, again, you can't see on this view, you can't see the carotid canal, which is going to be on this side. You can't really clearly make out, you know, this might be, but it's not really clear because there's not one on the other side. That might be the internal, but don't worry about it. Right? Just this is the petrous portion on this side of the temporal bone. And then again, your foramen magnum. So this is pretty much the same picture. I put those in because they're a little bit, I like them a little bit better. But everything I just pointed out, your crystal galley, your cribriform plate, or whichever one you want to memorize, olfactory foramina, right? These little holes. And this is your sphenoid. It's not really super clear. This is some of the sutures over here, but you got your lesser wings up here, your greater wings down here. And then this arrow is pointing to your optic canal. Again, your optic nerves are coming out of that right over your sella turcica. This is where your pituitary gland is sitting. And then within your sphenoid, you got the foramen ovale and the spinosum. No, I don't have these marked. So on this picture, you can actually see, here's the petrous portion. You see on the anterior side here, you could actually see this is the carotid canal from the superior view. I think this is the only picture where you can kind of clearly see it. And remember, on the inferior side, they're kind of the jugular and the carotid canal are right next to each other, but your jugular foramen is actually over here, right? But the carotid canal comes out on the other side of the petrous portion from the superior view. All right, so here is one of the few what you call disarticulated bones that you have to identify. Everything else is going to be within the skull, right? So I don't take off the nasal bones or the palatine bone and ask you to identify it individually. Everything else is within an intact skull. The exceptions are your mandible, your sphenoid is here, and then the ethmoid. Right, so here we're looking down again. Right, here's those optic canals. Right, your eyeballs are up here somewhere, and then the nerves come out, go through those canals, and then go back into your brain right there. So those are the optic canals, and again, this is the lesser wings. Here's the greater wings. Right, and then since this is the sphenoid, you got those two bones. The rotundum isn't really visible here, but you got the foramen ovale and the spinosum over here. Right, so this is looking down on it, the superior view of it. This is looking as if you were looking from the front, right, through the eyeball. This is like the back of your eye socket right there. So remember when we looked back in the eye socket from that frontal view way before, we saw that big fissure right here. This is your superior orbital fissure right over here, this big space right here. Right? And then this is looking from the front. This is your lesser wings. And then from this view, these would be the sphenoid sinuses. These are your lateral pterygoids over here. Your pterygoids, you could just call them your pterygoids, your lateral, your medial pterygoids. So that's on your sphenoid bone. Does everyone know where this is on the inferior view of the skull? That's these guys right here, right? It's kind of hard to see, but those are them from looking down from this direction here, or these things right here. Those are those pterygoids, spelled with a P for unknown reasons. All right, and then here's one of the other ones for disarticulated bones, your ethmoid bone. You got your crystal galley, right? So this is when we're looking down from the superior view of the open skull. We saw that cribriform plate and the crystal galley. Right? And then we're looking at the frontal view through the nose, and you're going to have the perpendicular plate, which makes up the upper portion of your nasal septum. And then over here, you have what's called the middle nasal concha over here. Right, your inferior nasal concha are going to be a separate bone on the inside, right? So these are part of the ethmoid bone, and that'll be the middle nasal concha. Right, and then the jaw is pretty much the same. Some of them are disarticulated. It's the same picture that on the articulated skeleton, except that you could see inside, right over here, you have the mandibular foramen. That's on the inside of the jaw right there, as opposed to your mental foramen, which is on the outside. And then you have the coronoid, shark fin here. And this is what makes up your TMJ right here, your condylar process, sorry. This is the ramus, and that's the angle. Mandibular ramus and mandibular angle. Right, and now we're looking at a baby skull. And again, for this one, remember that these bones haven't fully fused together right here. So you have this fibrous membrane when you're first born, a little leftover from it hasn't really fully grown yet. So this is why babies have these little soft spots on their head. It allows for a growing brain. It's called a fontanelle. And this is the anterior fontanelle right there. All right, so so now we're getting into the rest of the axial skeleton. You know, the easiest part is the whole thoracic part, right? Your rib cage, including your sternum over here, which is actually 3 bones that are fused together. So you have these 3 regions. They're technically 3 bones, but I could say what region / bone this is right here. Be specific. You'd say manubrium, body, and xiphoid process. Right over here. Of that. And then you got your ribs. And all you got to know about your ribs is that there's 7, right? 1, see it starts over here. 1, 2, 3, 4, 5, 6, 7. These are called true ribs. 1, 2, 3, 4, 5, 6, 7, right? And it goes up and they do join directly. 1, 2, 3, 4, 5, 6, 7. This is indicating the cartilage that used to be there, the costal cartilage. But they join directly to the sternum, whereas the false ribs over here kind of join in with the 7th one, or don't join at all, right? So the ones, there's 8, 9, 10 are 11, 12 are false ribs, and then 11, 12 are called floating ribs because they're not at all attached to the sternum. And then this is just the articulated vertebrae over here. I guess there's nothing really on this to speak of. And then again, this, like which vertebrae, which region is this? Which region is this? Which region is this? Which region is this down here, right? So you got your cervical, which you could tell the spinous processes are sticking kind of more straight out from this view. That's kind of the only way. Plus there's this weird thing over here for your axis. And then your thoracic vertebrae are 12 and their spinous processes are kind of pointing down more for the most part, especially one in the middle. And then your lumbar vertebrae, you get these big clunky spinous processes and they're connected in this picture to your sacrum. So here are 3 of the individual vertebrae. Again, for this picture, I could put any individual one up here separately. The little hole here on the side indicates that this is a cervical vertebrae. It's a transverse foramen. This nose that's pointed down, the spinous process that's downward slope right there. And if you can kind of make them out, these costal facets indicates this is a thoracic vertebrae. And this big, more clunky looking one is a lumbar vertebrae. That's it from the lateral view. It's a little more obvious, I think, from the superior view, especially with your cervical vertebrae. You got these 2 holes right here on either side, right? Your transverse foramen. And that's where you have arteries running up these holes right there. All right, and for these, you got your
Transverse processes.
over here. For these guys, over here. For these guys, and then over here for these guys. These are transverse processes, and then the spinous processes is going to be coming out the dorsal side right there. Down the middle here, you got your vertebral foramen. Your vertebral foramen, this is where your spinal cord is running down the middle right there. And then this is the body. That's really all you got to know for these guys. From the top view, I won't ask you the articulating facets. We'll get to that when we look at the frontal view. Again, this bifurcation of the spinous process indicates that it's a cervical vertebrae. These right here, and I have a better picture, but these are your superior articulating facets, right? Notice they're pointing outward. Here are your superior articulating facets of the lumbar vertebrae, and they're kind of pointing inward. And I'll show you that on a different picture, but that's one indication how you tell these two apart, right? Which direction they're facing. I'll go back to that in a minute. All right, here's some articulating facets right here. These happen to be thoracic ones. Right here, they're spinous processes. And so one of the reasons I'm using these articulating ones is you got these holes that are created when you start stacking up vertebrae together. Right, these are your intervertebral foramen, right over here. Notice on these, they have a half of one. Right, you can see a half of an intervertebral foramen for any individual one. Once you get to start stacking them right there, they form that whole intervertebral foramen. And these are where your spinal nerves would be coming out of right there. All right, same kind of picture, spinous processes, intervertebral foramen for your lumbar vertebrae. And this is an intervertebral disc right over here in between the vertebrae right there. All right, so this picture is what I was talking about before because they clearly show the facets. Right over here. And over here, right? So these guys, again, they're facing inward. That is a dead giveaway for your lumbar vertebrae, right? So from this picture, it's kind of hard to tell which one is which otherwise, right? When these guys are facing straight out, I can't really do that in a 3D manner, but you can imagine they're facing straight out at you, right? So these are the superior articulating facets for these. And I don't think I have any inferior articulating facets, but they would be down below over here, right on the other side. You can't really see them. All right, so you got your transverse processes, your superior articulating facets of each are the giveaway of which vertebrae these are. This is just a picture of the articulated cervical vertebrae, and then these are the C1 and C2. Right, so this is the named one. These are the only ones you actually have to identify by name. Right, and you can call it C1. You can call this the atlas, and this is the axis below it. And so here's your transverse foramen. This is where your superior articulating facet, this is where it connects, right? Articulates with those occipital condyles. And this right here is your spinous process, right? So this is the dorsal side, this is the front side right here. So this dens right here is a modified body of the axis, right? It's this thing that your atlas pivots around. So in real life, there's like a ligament strap right around here that secures it in there. This allows you, this kind of rotational movement allows you to rotate, shake your head no. And this is just a different picture of the same thing right there. All right, so here's another cervical vertebrae. Doesn't matter which one, has that bifurcated process. It has the transverse foramen, right? And then here are the superior articulating facets. All right, so for each individual vertebrae, I put a couple pictures here. Again, superior articulating facets, spinous process, transverse processes, superior articulating facet, transverse foramen, superior articulating facets, transverse process. Here's your lumbar vertebrae. You got your spinous process here and here. Your superior articulating facet, that's the surface. Remember the process, you could name it either one, you'll be right? But the facet is the surface, the process is the jutting out part, and then you got your transverse processes over here, and here's the body. And lastly, we have the sacrum, that fused part of the vertebrae, right? These are the sacral foramina, right? Those holes, and then down here is the coccyx. Right, so those are all the images.